Okay, hi, Dr. Sanders with Voyage Direct Primary Care. Today I wanted to talk about colds. It's cold season right now. It's in the middle of February, and we got a lot of people out there with runny noses and congestion and sore throats and all that stuff. And I want to talk about today what common recommendation that I have to folks that get colds, and then how to kind of avoid other things and whatnot. So, number one, cold. You got the typical head congestion, lots of mucus, lots of mucus. Things you can do with that mucus, I like to do 1,200 milligrams of Mucinex, plain Mucinex, just guaifenesin. There's a lot of combo meds over there and you don't often need all the different various combinations. Those just add lots of side effects to your stuff and make you feel groggy and sometimes really dizzy and funky. So just plain Mucinex, 1,200 milligrams twice a day. Mucinex breaks up the mucus, makes it more like water, so it doesn't pull in your sinuses or in your ears or in your lungs and predispose you to opportunistic infections. We'll talk about that in a minute. The other one is Sudafed, if your blood pressure will tolerate that. Another reasonable thing to do, again, plain Sudafed. It'll dry up the mucus in your nasal turbinates so you don't create as much mucus. And I just like those two medicines, honestly. There's dextromethorphan, the Sudafed DM. Again, that's the cough thing, and so I like people to cough. Certainly, if there's a cough that's keeping you up at night and all that, then maybe you can add some of those things. But honestly, there's things that I can add to your regimen that will be better than that stuff anyway. So opportunistic infections. The average cold lasts 3 to 7 days usually. And so that's very common, and you'll eventually kick it. Lots of water, lots of rest, lots of fluids, and Sudafed and Mucinex, and most people just the virus will run its course and your immune system will kill it. However, sometimes that mucus pulls, and it'll pull in your sinuses, it'll pull in your ears, it might even pull in your lungs and create what's called an opportunistic infection. And that's when I want to hear from you. So if you're past that 7-day mark, and you're having ear pain or you're having sinus pressure, again, past the 7-day mark. So I'm 10 days in and I've got this sinus pressure. Well, now you have a sinus infection. Well, what about in the first 3 days and I get sinus pressure? Well, that's all viral, right? Lots of mucus and it's still pulling in your sinuses and causing pressure, but the chances of that being bacteria are much less. If you're past that 7-day mark and it's starting to hurt, then yeah, you're probably got an opportunistic bacterial infection. Also, you can have pneumonias in that same time frame. Kids get otitis media, like an ear infection, very, very commonly as an opportunistic infection as well. So be on the lookout for those as well. And I think that's it. Yeah, Dr. Sanders with Voyage Direct Primary Care, trying to teach the masses and talk about colds today. Thanks, bye.